Hi, this is Dr. Lasso from Madrid. I'm a plastic surgeon, the current head of microsurgery in the Department of Plastic and Reconstructive Surgery of the Hospital Cruzado Marañón. I also teach at the University Complutense of Madrid. I want to show you today our experience in the use of Lympho-SPECT CT for the evaluation of lymphedema patients. Lymphedema supposes a big problem for the society. The patients spend a lot of money in treatments, they need to go to rehabilitation, they expend money in garments and bandages, and at the end they used to get tired and they abandon the treatment. Hopefully, surgery offers to the patients new solutions. Lymphovenous anastomosis, lymph node transfer seem to be a good solution for the patients. There are many reports referring good results. The patients behave better after the surgery, and there is a clear reduction in the volume of the extremities after the surgery. We need to know more about the results of our surgeries. We need to go forward, as well as surgical techniques improved along decades. There has been a good evolution and development of objective techniques for the evaluation of the lymphatic system. Lympho-MRI and ICG lymphography are accepted all around the world. But there are also classical techniques like lymphoscintigraphy, which can't be forgotten. In our opinion, we have a new tool today which can be helpful for the evaluation of the patients and for the performance of the following up. Lympho-SPECT CT provides good anatomical information as well as functional. Nevertheless, there is few information about the possibilities that Lympho-SPECT CT can offer to surgeons after LVA surgeries. Here, we present a new work, a prospective work, describing the findings that we saw in our patients after LVA surgeries. Preoperative Lympho-SPECT showed dermal backflow in all the patients, as well as an important absence of lymphatic nodes. But 1 year later, after we did the surgery, we could see objective findings that may describe the possibility of redistribution of the lymphatic flow. We described new lymph nodes at the axilla or at the groin. We also described a remarkable reduction of the dermal backflow. But what is important for us is the appearance of lymphatic spots along the pathways. These lymphatic spots could be related to the redistribution of the lymphatic flow, but it could also be a sign of the new function of the lymphatic system, in special a good functionality of the lymphatic anastomosis. These results were significant and positively correlated with the reduction of the volume of the limbs. On the other hand, we need to know what it means. We need to operate on more patients and do new evaluations in order to obtain promising results and results that can be demonstrable and feasible. In conclusion, we consider that it is a mandatory tool for our protocol for the surgery of the lymphedema, and we hope that we can share with us this experience. Thank you to Plastic and Aesthetic Research for this opportunity. Regards for everyone.